Welcome to another episode of Well-Adjusted Mama. This is a podcast dedicated to educating and empowering women from preconception, pregnancy, birth, and through early motherhood on wellness lifestyle. I'm your host, Dr. Laura Brayton, and I'm a maternity pediatric chiropractor as well as a mother who has hand-selected experts in natural holistic healthcare specialties to shine light on options and choices during this exciting phase of a woman's life. And today I had the honor and privilege to interview my soul sister in preconception health and empowerment, Alexandria DeVito. And we talk about everything preconception based off of her book, 9 Months is Not Enough. Alexandria DeVito is a functional nutritionist who specializes in fertility and preconception health. She's the founder and CEO of Poplin, the first pre-pregnancy wellness company. Prior to founding Poplin, Alexandria worked in management consulting at McKinsey Company. She holds an MBA from Harvard Business School. She also has a master's degree in nutrition, extensive training as a doula, yoga teacher, and personal trainer, and is an Institute for Functional Medicine certified practitioner, all of which inform her approach to pre-pregnancy wellness. Hi, Alexandra. Welcome to the show. I'm very excited to have you on today.
Thank you so much for having me.
So we share a passion for preconception health, which is really about being conscious and deliberate in preparing physically, mentally, emotionally, and spiritually prior to actively trying to conceive a baby. And it's a topic you and I were speaking before we started recording that is really, in modern culture has not really been on the radar of a lot of couples. And I think is now starting to shift where people are like, I want to start actively having unprotected sex to make a baby, let's say 3 to 6 months from now. What do I need to do? As opposed to people would be like, oh, okay, we're going to start trying to have a baby next month. And it was literally like, I need to know when I'm ovulating and have unprotected sex several times during that window. And if it doesn't work, I'm going to do that again next month. And if it doesn't work, I'm going to do it again next month. And if I do it for a year, then and it's not worked, then I need to go to a fertility specialist. And there's a big gap there that's missing, right? So tell me about how you got into this space, like why you're so passionate about this.
Well, first of all, what a brilliant introduction into this conversation. I think that's a really good summary of, the current approach and an invitation into potentially another way of doing things. And so the way that I came into this world was I actually started on the corporate side. I was a banker and, what feels like a previous life now, and then a consultant. And I worked in the healthcare space when I was a consultant. So with pharmaceutical companies, med device companies, and that's how I learned about the healthcare landscape and really got passionate about working in healthcare. And then at some point I decided that I wanted to switch from what I felt was a reactive model of healthcare to a more proactive one. And that was the impetus to go back to school. I went and did my MBA at Harvard, and then I also did a part-time master's in nutrition on the side to add more tools into my toolkit. And once I finished both of those master's degrees was when I switched from the corporate world to the clinical world. And I started working as a clinical nutritionist. And at that time, I was also, as we were just talking about, doing my functional medicine training and learning about, root cause analysis. And what ended up happening and, why fertility became the thing that was top of mind was I ended up having a lot of clients who were coming to me as a nutritionist who had been struggling to conceive, as you were saying, for a year, sometimes 2 years, sometimes 3 years, and they still had no answers and no baby. And they were coming to me as almost a last resort. I've done all the other things that I can think of. Do you have any other suggestions for me? And I was really struck by that. And initially, I wasn't sure. I really started to dive into a lot of the clinical literature to say, what could be happening here, right? What do we know that could potentially be interfering with fertility? And so I looked at all the clinical literature, and then I designed these really broad tests inspired by functional medicine. And all of a sudden, I started flagging things on test results that my clients' providers had never even looked at in the years that they were struggling to conceive. And once we were able to address those things, which could be nutrient deficiencies, inflammation, right, a whole host of things, oftentimes through diet, lifestyle, supplementation, sometimes medications and procedures in collaboration with their doctor, they were able to get pregnant. and whether that was naturally or in the next round of assisted reproductive tech. And so it occurred to me, why are we waiting until someone is deep into a fertility struggle to even screen for these basic things that we know can interfere? What if we were to do this screening on everyone before they even started trying to conceive? And that was when I was introduced to this concept of preconception, which, we've had clinical guidelines for 40 plus years, but nobody seems to be following them. And nobody even knows about them, both on the provider side and on the consumer side. So that's when I realized that there was an opportunity to kind of rewrite the dialogue and to really educate people about preconception and give them resources to prepare to get pregnant like they prepare for any other major milestone, like a wedding, a year in advance, with guidance, tools, and support.
That's awesome. Yeah, it really, success comes from preparation, right? And, I think it's also coming from a place of not being stressed about it. We know stress impacts fertility and impacts our health. It's pro-inflammatory. It's going to create I was just learning on IFM hormones that when we're under chronic stress, it's going to cause ovarian inflammation as well as inflammation in other parts of our body. When our ovaries are inflamed, we're going to have lower progesterone. We know that's linked not only to fertility, but also early miscarriage, right? So we'll even see, I'm sure you've seen this in your practice and I have as well, women who can get pregnant pretty easily, but they're not sustaining that pregnancy. And that's, also a component of infertility per se, right? You can conceive, but you can't carry a live full-term baby. So that there's an indication that support is needed and we need to do things differently, right? Because we want to do things differently to get different results, right? So this is such an important topic for anyone who is looking to have a baby and really looking for overall health and wellness and making these necessary lifestyle changes beforehand. And you said the word 1 year, which I think is fabulous. A 1 year shift. I think it also really depends on where a woman and man are starting from, right? The parents. But if they're coming from a really poor health situation, you're going to need a lot of time to change that before you start trying.
Absolutely. I think that it depends on what your starting point is. And I think what we do in a lot of medical care today is we treat everyone based on age-based curves. So, you're 30 years old, therefore there's X intervention. You're 40 years old, therefore there's Y intervention. And I think we both know that there's a difference for most people between their chronological age, meaning their age in years, and their biological age, meaning the vitality of their cells. And so if you happen to already be fairly active and be fairly conscious about the products that you use and your blood sugar and your menstrual cycle health, right? You may need a slightly shorter amount of time. If that's not been your history, then that's fine. Then you might, but recognize you may need slightly longer amount of time. And the last stage of egg maturation is about 4 months, 3 to 4 months. And a sperm development cycle is about 3 months. And so if we think about that, we may need several of these egg development and sperm development cycles to optimize to the level that we want to pass on to our future children. So when we think about it that way, that's how that time frame breaks down. And so 1 year is a rough time frame. I looked up the stats on this because I was so fascinated, but it's about 15 months that people spend engaged. So I think that's a good, metric of, the amount of time that we're preparing to get married, right, is a similar time frame that we think about preparing to conceive.
Oh, I love that idea. Right. And I do think that typically after people get married, then they're, looking to start trying to start a family somewhat quickly, right? Especially depending on the age of the parents. Both of us having been in the New York area, there's a lot of couples that get married a little later, and therefore they're not necessarily having a long newlywed stage before they're actively like, okay, we need to start trying to have a baby because we're over 35. But I do really appreciate you mentioning the biological age versus the chronological age, because that is not something that's part of mainstream medicine. And there's a lot of fear mongering that occurs for the women I meet in my practice who are they're ready to starting a family over the age of 35. They're established in their career. They've met, their partner, their life partner. And they did it later than women living in other parts of the world and or country, right? Or have already had their 3 kids. And the traditional OBGYN is like, oh wow, you're over 35, this is going to be hard. There's a lot of fear, and instead of really being like, well, let's look at where your current health status is. And then we can actually not speak out of our ass. We can just not apply the, one size fits all approach. So can you speak a little bit about women that are, let's say, over the age of 35, looking to have their first child, and what that looks like from a egg perspective?
I so appreciate you saying this, because I think you're absolutely right. And I see this too. I mean, the amount of fear mongering in this area is a lot. And I think it's resulted in a lot of reproductive anxiety where, females are anxious about their ability to get pregnant and have a healthy pregnancy and baby. And they've been told there's nothing that they can do about it. Right. And I think when we have something that's high importance, like building a family, but we've been told it's low control, meaning we can't do anything about it, just have gotten pregnant younger, right? Which is helpful to no one. Then,
you should have frozen your eggs. Too late now.
It's not helpful, and it's not empowering. So I think that the reframe here is that to define you by a single number, which is age, is just reductionistic, and it is ineffective in most cases. So I think what a better way of looking at it is, what is your pre-pregnancy wellness status, right? And the way that I look at it is that fertility is an extension of your overall health. It is not just a below the waist conversation. It is not just about your reproductive organs. It is not just about your hormones. And it is about the categories that we look at are blood status, hormone status, of course, metabolic status, nutrient status, immune status. All of these things can affect egg quality or sperm quality. It can affect endometrial receptivity. To your point, right, there's a lot that can affect not only your ability to get pregnant, but sustain a pregnancy. And so we can screen for all of these things. So rather than saying, oh, you're 35, so now you're quote unquote having a geriatric pregnancy, which don't even get me started on the branding there.
I hate that.
Right?
I hate
it's nonsensical. We can look at what's going on in your cells for your body. And particularly if you're getting pregnant later in age, it's even more important not to waste time on shit that doesn't matter for you, right? So doing an average protocol for an average person is not helpful oftentimes. So understanding what you are working with and what your reproductive partner is working with is so much more efficient and effective than, kind of running around throwing stuff at the wall and seeing what sticks.
That's right. That's right. It's really that individualized, customized approach for both partners to say, this is where our health is and what do we need to do to get to the next level, and then make a baby, essentially. So can you talk a little bit about some of those tests that you would recommend for both partners to do during this preconception stage?
Absolutely. So I mentioned the categories, and I'll kind of go through a little bit of what we're looking at and maybe some of the more common things that we see. So, and the first one is blood status. And there we're going to look at, usually it's a CBC, but really what we're screening for is, are there any markers of anemia? And in particular, what we know is that up to 25% of pregnancies are characterized by iron deficiency anemia, which is a huge number. So, and this is something that is easily screenable and oftentimes fairly addressable if we know about it in advance, right? So I think that's, one thing that we screen for and look for. Then we look at immune status. So immune status is going to have screening for indications of autoimmune disease. And it also has STI screening, which is a standard part of all first trimester testing. And, on that, I would ask the question, right, why are we waiting until the first trimester of pregnancy to find these things out, right? It's much more efficient to understand beforehand if there are sexually transmitted infections, potentially that have been latent and, have not had any symptomology for years and years and years. And, if those need to be addressed, it's really important to address them beforehand. And with regards to autoimmune conditions, I think, this one's an important one. And, I'd be curious if you're seeing this more and more, but we have a lot of folks who are being diagnosed with autoimmune conditions. It's on the rise, and it's disproportionately present in the female population. So about 80% of autoimmune diagnoses are in females, and it takes on average 5 years and 5 different providers to get a diagnosis.
Wow.
Yeah. So it can be very, very complicated. And so I think it's, an important thing to screen for, because it can be responsible for recurrent miscarriage in particular,
yes,
among other things.
Yes, for sure.
So
I see that so much with like celiac, gluten intolerance, which is not technically autoimmune, but anyways, how that is directly connected to recurrent miscarriages.
Mm-hmm.
Yeah. And like what we're talking about, autoimmune is systemic inflammation to a certain part. Like there's certain parts of the body that are more inflamed, right? The joints, the skin, the gut. But at the end of the day, we know that this inflammation is going to disrupt hormones and impact the body's ability to heal, right? And that's really important to address before we get pregnant.
That's such a good point. Yeah, I think, when we think about the implications of an autoimmune condition, systemic inflammation is one of them. And then I think you also think about the immune system's set point, right? If our immune system is set on high alert, right, then it's reacting to a lot of things. And if it's set low, then it's not reacting to things potentially that it should have, right? And so monitoring this balance is, an important place to be when we think about getting pregnant. And then certainly, we shift into a different type of dominance when we're in pregnancy. So that's, to be able to sustain the pregnancy. I mean, the immune system is absolutely fascinating. And, I think it's not being looked at enough, particularly given what we're seeing in terms of the stats around the rise of autoimmune conditions.
No doubt. Yeah. And I mean, I even have concerns about how vaccines given to women preconception and during pregnancy are impacting their immune system and creating confusion.
It's fascinating. I think, we don't know all of the factors that are driving this. I mean, the statistics are astronomical, and they're increasing really quickly. And so you have to start to parse things apart and say, okay, like what could potentially be driving this? And my guess is it's probably not one single factor.
Not at all. Multiple. Yeah.
And, all of these things are really compromising our immune systems and confusing the heck out of our immune systems about what it should and should not be responding to. So, I imagine there's going to be a lot more research coming out, or I hope there's going to be a lot more research coming out about what might be driving a lot of the patterns that we're seeing. Yeah.
And at the end of the day, to your point, there is certainly a multifactorial, cause here. And I think that's what even creates more confusion, because it's not an easy just point at one thing. So we have to be educated consumers of our health, and we have to look at all these different factors and see how we can minimize exposure to different toxins in our environment and in our foods. So I know you're super passionate. Oh, sorry. I think we were going through the testing. So we talked about blood. I think I got you off track.
No, this is good because it's a rich discussion to dive into each one of these. They're a whole topic unto themselves. So we did blood and we did immune. So hormone is the category that most people I think are familiar with, but we take a really broad lens when it comes to hormones. So I think, a lot of times when we talk about hormones, we think about sex hormones, and that's phenomenal. But sex hormones, as I'm sure you're looking at, right now with the hormone module, are downstream of our thyroid function, and thyroid is downstream of our adrenal function, right? So if our sex hormones are off, we have no idea why. Is it, at the sex hormone level? Is it at the thyroid level? Is it at the adrenal level? So understanding all of those pieces of the puzzle can be really helpful to contextualize what is actually going on. And then, right, certainly nutrient deficiencies can contribute to, whether things are converting versus not converting. So having all of these data points rather than just looking at your sex hormones can really help us understand what's going on. And then once you understand what's going on, you can intervene differently. And then, the second layer here is beyond all of those hormones, we also look at binding globulins, because again, the way that you would manage a situation with someone that is producing adequate hormones, but has high binding globulins, meaning those hormones are essentially inactivated in their body, versus someone who's not producing enough, is very different. So just understanding all of these nuances within hormones is really, really helpful.
Yes, it is. So I like to use Dutch test for that type of thing. What type of tests do you typically work with to check for the hormones?
Dutch is fantastic. We do a screening test at Poplin that has our own grouping of tests. So, we're looking at a variety of thyroid tests. So we're looking at 8 different thyroid markers. We'll look at cortisol, and then we'll look at all the sex hormones. And FSH, LH, estradiol, testosterone. We'll look at DHEA, and then SHBG, so sex hormone binding globulin. So it's a really comprehensive hormone panel.
And some of that's blood. Is there also urine and saliva?
We're just doing blood for the hormones. And the one hormone that we're not looking at that I think can be helpful is progesterone, because it has to be tested at a different time of the month than these other hormones. And I find that there are decent at-home progesterone, at least progesterone metabolite tests. So that can be a really good adjunct. But we get really, really good data, even in the blood.
Got it. Okay. I know I find cortisol is really nice to do with the saliva, because then you can check it several times during the day. You can see if there's spikes, is it flat? And that's so indicative of the overall health of the adrenals.
For sure. Yeah, I think there's some really interesting adjunctive tests to what we do. What we've designed is a really good screening test to say, okay, well, let's take a step back and look at a broad lens of where might there be areas of concern. And then, as you said, sometimes things flag, and then we say, okay, you know what, we probably need a little bit of a deeper exploration there, and then you can dive in.
Go further. Mm-hmm. So if somebody's ordering the Poplin blood test, how do they get the blood draw done?
They could either, they can elect to go to a local lab near them, or they can elect to have a lab draw tech come to them and do the blood draw in their home.
Oh yeah, that's nice. Prefer. And then it's shipped off to the lab, and where's the lab located?
They're national. So wherever you're located, there'll be local labs, and they'll do the analysis, and then the results will come back through our app, and you can kind of go in and it'll say, for each marker, what does it mean? And what is the marker and what does it mean? Like, why should I care? And then you could have a call with one of our pre-pregnancy experts to review the results and discuss next steps.
Oh, that's really cool. So what other type of testing do you recommend during this preconception stage?
So, I think, it depends a little bit on the individualized situation, right? So I think that there's the test that we do is the initial starting point. And then I think if you see certain dysregulations, then it can be helpful to do deeper dives. So potentially sometimes, yes, if you see a bunch of hormonal dysregulations and you want to do further, sometimes you can even do cycle mapping. Like if people aren't having, regular cycles, you can actually do tracking over a full month. That can sometimes be helpful. I do think that both the combination of LH, so luteinizing hormone analysis, and PDG, which is a progesterone metabolite, so you can predict and confirm ovulation. That's a great adjunct as well. I think if we have concerns about nutrient deficiencies, then one thing that sometimes I will look at is thinking about gut function and stool testing. So to understand, because we don't, even if we're eating the best foods, we don't always digest and assimilate them.
Right.
So, sometimes you can think about doing stool testing. And then I think, the other ones, right, starts to get into, more specialty testing, where, you're looking at detoxification function as well. So I think there, if we have concerns, that might be another area to potentially explore in collaboration with your doctor.
Yes. Yeah, I do find that, the average woman who's looking to get pregnant has an awareness that she needs to be eating healthier foods, right? So they might still need a little support around diet, but there is an awareness that nutrition is important. I think most people understand that. But to your point, if there's a history of leaky gut and gut dysbiosis, and there's imbalance in that gut microbiome, then you can eat these really great nutritious foods and you're not absorbing the nutrients effectively. And also it's very challenging to even get nutrient rich foods nowadays with the depletion of soil. So it really requires someone to almost get a nutrition degree to really understand how to feed and nourish your body and eat the rainbow and, have all these phytonutrients and along with your partner, right? Because they need to be eating all these wonderful, healthy foods as well. and recognizing that when we don't eat those foods and we're replacing it with something non-food, right, chemically processed, how that's also depleting our body. Or if a woman, for example, was on the birth control pill for, let's say, 10 years plus, and now is like, oh, I'm going to stop taking the pill because I want to, get pregnant in 3 months. Well, that was 10 years of B vitamin depletion and a hormonal imbalance that's happening that was never addressed, potentially, if you don't know that the birth control pill does that. And you're just thinking, okay, I'll just, give my body 3 months to start cycling and no problems.
There's a lot that you said in there. I think that's important. What I generally tell people is that coming off of hormonal birth control is an active process rather than a passive process, right? Where, yes, we can go off of it and hope that everything will work as we desire it to. But often if you give your body assistance, it can make that transition much better. And to your point, right, a lot of the vitamins and minerals that are depleted on birth control are the very vitamins and minerals that are going to be needed to support your fertility. So, making sure that we're repleting those vitamins is incredibly important. Birth control has been shown, yes, to disrupt our microbiomes. So supporting our, microbiomes as we make this transition, right? If we went on hormonal birth control for any reason other than contraception, we likely had an underlying hormonal imbalance, and that was not addressed, right? By going on
not corrected. That's a myth that I think a lot of women don't know. They're like, well, my symptoms improve, so therefore the pill must be balancing my hormone. And I'm taking hormones, right? So therefore this must be balancing my hormones. But we're speaking to the suppression of symptoms like a bandage rather than really addressing the underlying root cause of the hormone imbalance.
Yes. And that's, I think that's important to know. I didn't even know that when I started looking into all of this data. And, I think birth control is seductively good at doing what it is marketed for, which is suppressing symptoms. But as you said, it's not addressing the underlying imbalance. So practically speaking, what that means is if you go off of hormonal birth control, you are likely to re-experience A, those symptoms, but B, that hormonal imbalance that was driving the symptoms in the first place. And it may have even exacerbated over the years that you have been on hormonal birth control. And all this is to say is it's helpful to give your body time to address this once you come off of hormonal birth control, to figure out, okay, well, what is my acne telling me, right? Is it that I have excess testosterone in my body that we're not processing properly? What are these really severe period symptoms telling me? Oh, maybe it's that I have an excess of estrogen that my body, again, is not able to process. And, we can take these signals and try to play a little detective work and decipher them. Then we can start to think about, okay, well, how can I address them? Because it's unfortunate, but period problems are often an indicator of potential fertility challenges. So we can ignore them, but if we address them, it means usually an increase to fertility in a more seamless process when we are trying to conceive.
Yes. And I will tell you, Alexandria, I see a lot of teen girls in my practice. And I am so passionate about, from that first menses, that we really support that young woman's life, reproductive life at that point, even though she's years away from ready to becoming a mother, right? But we know that if she's having these really irregular, heavy periods, cramping, that, she has to miss school, these are red flags. And acne and all these things that you're mentioning are not normal. They're not normal. And there is an indication that there's some imbalances and toxins in her body that can be safely and effectively addressed, and does not involve hormone birth control. And so I think a lot of times, a concerning parent will take their daughter to the gynecologist, right? And then the result is a prescription for the pill. And so we just want, I want moms of teen girls to know that there's alternatives for that as well. I mean, we're talking preconception, but preconception can start decades before that woman is ready to become a mother.
Which is, I'm sure, like terrifying and liberating all at the same time. Right? I think it's beautiful. I think you made a really interesting point, which is that like a lot of these symptoms have been normalized, but as you said, just because they're common does not mean they are normal, i.e. the way your body was designed to operate. And this is not to blame or shame anyone if they're experiencing this. I had my own host of period symptoms that I was dealing with before I even knew that I didn't need to deal with them. Right. And so I think an invitation into it doesn't necessarily have to be this way if you don't want it to be this way. And everyone gets to choose what their path is. And I think it's just really important that we have informed consent. And so knowing, okay, yes, you can choose to take hormonal birth control because it has a lot of actually, wonderful benefits for being able to pursue life and careers in the way that, we desire. I think it offers a lot of freedoms, and it comes with side effects like any medication. Right. And I think that we have shared as much of the side effects of these medications. I think, we, for part of it, we didn't know, although, there's been some pretty good data for, a bunch of decades about kind of nutrient depletion, at least on birth control. Some of the other, I think is newer that people are now speaking out about. So I think it's just about having informed consent. These are the options, and here are the pros and cons of each option. And then you get to decide what is best for you and, your future family.
Yeah, that's back to the empowerment, is really understanding and making conscious choices for your health and recognizing how this can impact your future health, right? Because I'm sure a lot of 16-year-old girls aren't thinking like, oh, wow, this could impact my ability to get pregnant 20 years from now, right? So I better think hard and long about it, because that's just not necessarily on their radar. And that's where, parents come in, right? To help have that awareness and have these conversations. And, even like an adult, like a college student, right? Like they're making healthcare decisions for their own body, but they may not have all the information there. So, for a woman like that, I think the internet has been a game changer. Social media has been a game changer. Women, we love to share and connect, and now we can do it at such a higher level. And so this goes back to like anytime you're making a decision around your health, you don't have to just listen to the doctor who's in front of you at the student clinic, for example. You can get other, you can look and ask other people and get, find out more information. I think it's just shifting the way we practice self-care for ourselves, right? Because that wasn't available to our parents and grandparents and ancestors. They just didn't they had maybe one doctor in their town, and whatever that doctor said was what you did. And there wasn't a lot of awareness about other options.
Well, this podcast is a perfect example of that. I think, it's offering a different potential reality and option set. And I think the important thing is it's not whether someone takes it or not. It's just that they're even aware of it, right? Yes. Expanding your awareness of what is possible. It's really hard for us to live into realities that we don't even know exist.
Yes.
So, the more that we can put items on the menu for people to choose from, I think is a beautiful thing.
It really is. I love how the yoga teacher in you is coming out as well. Which is beautiful, because it's true. Like if we only know what we know, right? And so I think it's just great. Like I want to speak a little bit more to that actually, because if we don't know what we don't know, then when we're having, let's say, coming up with this opportunity to want to start having a baby, we might be doing some research, but we always can also listen to our gut intuition, right? And if we're going down a path and doesn't quite feel right, then that's an opportunity to do a little more research and talk to a little more people, get a second opinion, third opinion, whatever. And until you feel like you're really on that right path for you as an individual.
I love that. And I think, I really do take this concept of, I think it's important to hear the perspectives of others and those who have a lot of experience, like you and I, and put it in its rightful place, right? I think you should question everything that I'm saying as well, right?
Yes,
and see if it resonates in your own experience, in your own life, and if it makes sense for you right now. And if it does not, put it in a box and put it to the side, right? And so I think filtering a lot of these perspectives, because we have so many perspectives coming at us all day, every day. And I think it's the combination of, right, turning outward, turning inward, and like, what is the mix between those two? Okay, I can listen to this perspective, and then does it feel right for me in my life right now? And
yes.
If no, great.
And no problems. Yeah. It's like not even, it doesn't have to even be like emotional. It's just like a yes or a no. I think what I find sometimes too is women feel challenged when they're in that gray area and they don't have a strong yes or a strong no. And there's a lot of confusion. And then they get more and more and more opinions, which will create potentially more confusion here. Mm-hmm. And that might be, if you're feeling that way, that might be an opportunity to be like, how do I get into more of a grounding practice, a meditation practice? Because I feel like when you are in that place, it's much easier to know that the yes and no for yourself and to move on. Like you're saying, you're not like dwelling, like, did I make the right decision? You know it. And then you're like, this is right. And I'm not looking back. I have no regrets here.
Totally.
Right. So, Alexandria, I want you to share about your book that came out recently, right? Mm-hmm. 9 months is not enough. It's the ultimate pre-pregnancy checklist to create a baby-ready body and build generational health. Love that title. I want you to elaborate on this book, and I really want you to talk about generational health because I'm also very, very passionate about that.
Mm-hmm. Yeah. So, I wrote this book because I felt like there was something missing in the dialogue, like we were talking about, right? Nobody really knew what preconception was, what the heck to do about it. And I felt like, I'm a relatively type A individual myself. And, I like organization and planning, and I like to be proactive. And I just thought to myself, like, where is the checklist for preparing to get pregnant? Like the checklist for getting married, right? Or the checklist for buying a house? Where is it? And, I get that there's modifications for people's individual circumstances, but the vast majority of things are consistent across the board. And then you can tweak on the margins the things that are relevant to you and any, health history, personal or family, any situational things, any values and preferences, right? All of that stuff. And so that's how I designed the book. And the first part is just all about the stuff that we've been told, quite frankly, that is a lot of bullshit. And, because I think a lot of learning is also unlearning. And like a lot of the things that we've been talking about today, there's a big piece of understanding that, like, yes, like period symptoms are common, but not normal, right? I think that's a really important piece. The things that we talked about around, the biological age versus chronological age and, even the success of fertility treatments, I think is not really well understood, and that, they're a foolproof method, which is not the case. So I think just all of these things were really important grounding. And then, inviting people into a new option, which is preconception, which is preparing to get pregnant before you start trying, and to spend more time in the preparing phase rather than the trying phase, which, right, as soon as people enter the trying phase, it's like, well, I want to be pregnant yesterday. And that's a lot of pressure on you, a lot of pressure on your reproductive partner. And so, I think there might be a better way that we can do this. And, then the whole rest of the book, the back part of the book, is about the checklist. So what are the different pieces of the puzzle, which, I'm hugely biased, right? So it includes pre-pregnancy testing and, getting your baseline, having a preconception visit with your doctor, which is a thing. And most people don't even know what that is. So I talk about kind of what are the things to prepare in advance and make sure that you cover. And then, the last piece is around addressing the biggest fertility blockers in our environment, which you've alluded to a bunch of them, which is we're eating less food, more food-like substances. We're not moving very much. We have high stress levels, and we're living in a environmental chemical soup. So managing those things so that they're in line with fertility, because the reality is that our bodies were designed to conceive, but our modern environment was not. So I think it's important to change our environment so that it's in line with our fertility goals. So that's kind of an overview of the book. And then the generational health piece in particular is, right, so I really wanted to introduce this concept so that people talk about it and understand it and cultivate it in the same way that we think about generational wealth, right? And generational health is the state of your health that is passed on to your future child that influences not only your future child, but generations beyond that. And the way that that is happening is through epigenetics. And epigenetics is still like a fairly new field, and we're learning new things about it every day. The science is evolving very, very rapidly. But we used to think, oh, okay, well, genetics is king. We're handed this deck of cards and there's nothing that we can do about it. And now we understand, well, actually, that's not really the case. Yes, there is genetics and those are important, but the vast majority, and a lot of studies are suggesting 75% plus of health outcomes are actually epigenetics, which is the environmental impact or lifestyle impact on your genes. And that causes your genes to either move in a direction that is, well, let's say fostering health or fostering disease. And, you have a whole bunch of these things, and they, they're modified by our food, by our stress levels, by our, support networks, all these different things. And so you have the ability to shift your epigenetic markers in egg and sperm so that that is what you're contributing at the point of conception to the lifelong trajectory of health for your child. And so that's really why what you were doing in that 3, 6, 12 months prior to conception is so important. And in particular for male partners, right, that is their epigenetic contribution. So I think it's really, really important to do that. What they're doing prior to conception is really what they're contributing from a health perspective to that child.
Right, because they're not growing a baby inside their body, right?
Correct.
But yet the baby's genetics, 50% come from the male partner, right? So their lifestyle is huge. And sometimes I do see, when I'm working with women preconception, it's a little hard for them to convince or educate their partner that, drinking a 20-pack a beer a week is not helpful for conception and, their pizza and their other lifestyle choices. So, I mean, when you're speaking to women, like, how do you require that the male partner be part of the process? I mean, what do you do?
Yeah. So, I think from a testing perspective, one of the things that was really important to me was that we built testing for both reproductive partners.
Yeah.
And, because of exactly what you said, biology does not care about our cultural construct that fertility is a female problem. It is a 50-50 biological equation. And in any mathematical equation, if you only optimize 50%, you're not going to get the biggest bang for your buck, right? So, once we understand that, I think that's the first piece. And globally.
So just to interrupt, when the guys do the test and they get back bad scores, that's probably an incentive for them to make lifestyle changes, right? Because it's something they weren't even aware of.
Yes, I think the tide is changing because I've spoken with a lot of males of reproductive age, and I think that they want to be part of this journey. They have historically been excluded, and I think they also don't know what exactly to do. So I think inviting your male partner into this conversation and making him realize that he is a really important part of this equation. And look, I understand that that may not be true of all relationship constructs. So for the relationship constructs in which this is relevant, I think it's important to invite your reproductive partner to the table and to say, hey, like, if we're going to be parenting together, I think we should be preparing together. And here's why, right? And I do think that any individual, but I think, some males tend to be more motivated by data, right? Yes. Some individuals tend to be more motivated by data. So seeing it in black and white, oh, okay, this is something that I can now do, can be really helpful. And if you think that your reproductive partner may respond in that way, it's a great tool to use to say, okay, we're both going to kind of do that. And like, there might be some like little healthy competition too. Like, okay, what does your, results say? What do my results say? And like, how do we improve them? Right? You can be playful with it as well.
Yeah. Oh, I love that. And so when both partners are, getting these objective factors, making changes, and then I'm assuming they might even repeat some of these testing, right? If they want to see now if they're in the optimal range before they start trying to conceive. What we're speaking to on building generational health is the best egg and the best sperm are the ones that are making that baby. And therefore you're going to have the healthiest embryo, fetus, child, who's then going to go on and also reproduce.
So well said. Yes, absolutely. And I think one other just like fun fact that I think about, you know, having looked at a lot of lab tests at this point, it's really fascinating to see a lot of parallel patterns between partners, right?
Oh, well, because they're in the same environment,
Yes.
possibly eating the same foods,
You got it.
moving the same amount. So yes, that's actually really fascinating. People, you know, the same thing, people looking like their dogs, right? You spend enough time with somebody, you just start to take on the similar attributes, right?
Yeah, so it's interesting. And so, right, this is a time period that has huge dividends, not only for your individual health, but, you know, the health of your collective family in exactly the way that you described. And so it is, you know, not about eliminating every single possible eventuality. You know, it is about optimizing what you can do and what optimizing what your reproductive partner can do. And then together, what that future child of yours could, because it really makes a difference when it comes to, you know, your not only fertility, but, you know, pregnancy outcomes and postpartum outcomes as well. A lot of the same risk factors that can interfere with fertility are the things that cause challenges with preterm delivery, you know, a baby that is small for gestational age, large for gestational age, increasing the risk of C-section. All of these things, they're all correlated to one another. So the more that you can prepare in advance, the more downstream you minimize the risk of other complications as well.
I'm so glad you said that, because this podcast really also focuses a lot on empowered birth, right? Which is on the other end of this preconception. And an empowered birth starts with preconception, right?
Yes,
so
I love that.
Right? Write it down.
So
It really does. So, you know, you don't just say, I'm going to try to get pregnant, and now I'm pregnant, and now I'm like 39 weeks pregnant without any birth preparation. And now it's like, what's going to happen? The birth can go sideways, right? So all of this, not to be that we need to analyze and you know, be overly stressed about all these decisions, but we just want to be empowered and educated and conscious as we're going through this perinatal phase of our life, and understanding that different choices and decisions we make along the way will impact what happens next, right? It's all connected.
It is. You know, you're actually reminding me of something. I had this aha moment when I was doing my doula training, which is exactly what you said, which was we were talking through different birth interventions, like, you know, and giving people options, like, do you want this or that? And, you know, sometimes certain decisions negate other decisions, meaning if you choose this path, you can't go down this other path.
Right.
And so, you know, I realized a couple of things in that, which is, you know, sometimes people would say, well, like, I want to go down this path. But what I realized is that path may not be available to you because of choices that were made previously. And people don't realize that. So, you know, a simple example is if someone is classified a high-risk pregnancy, and I'm not talking high-risk pregnancies just because you were older, like that's nonsensical. I'm talking about a high-risk pregnancy because potentially you have a health condition, right? And what we say is, okay, that is a high-risk pregnancy. So certain things are not on the table for a person who is a high-risk pregnancy, or they hold a lot more risk. Right?
Yes.
But in order to allow that option to be on the table, we don't address it at birth. We have to address it before getting pregnant, meaning making it such that it's not a high-risk pregnancy in the first place.
Right.
And so as you're saying, all of these periods relate to one another. And so we're trying to intervene at the point of pregnancy or at the point of birth, but that's oftentimes too late to intervene because the foundation has already been set. And if we can move the goalpost a bit earlier, then it opens up a whole other set of options that we weren't even aware were available.
Yes, it's 100% true. And so I think that's just really important. Like, we don't want to be reactive in our decision making, right? We ideally want to have like this blueprint, like you're talking about, this checklist. And then it's like, okay, I know what I need to do. And is there some accountability then that's also helping people support like these lifestyle changes that are recommended?
Yeah. So, I mean, as I was mentioning, we were talking about after the call, you can have a call with one of our pre-pregnancy educators to talk about kind of, okay, how to, you know, start thinking about what the next steps are. And, you know, we're building out some new stuff now too. So stay tuned, you know, for more. But really the whole goal of this is to just get you the information that you need to start making changes. I've been so impressed with our customers, with the speed in which they start to implement changes in their own life and maybe make follow-up appointments with their doctors, you know, make changes to supplementation or lifestyle or diet, right? I mean, I think that once people have the information, they're highly activated. And so, oftentimes it's just a matter of giving people the things that need to be addressed, and they will often take the baton from there.
Got it. And I think also, to your point, the motivation is coming from this strong desire to become a parent, right? And so that's highly motivating. And it's ideally then if you're doing it with your partner, there's support coming from there. And I know there's also even I don't know if you have a Facebook page that has a forum like that, but there's a lot of groups out there like that help just connect women with other and partners with other people that are in the same life stage that they're in.
Mm-hmm. Yes,
right. Preconception couples.
Thing. It's a beautiful, beautiful thing, and if you can share the journey with other people who are going through it, right?
Yeah.
A whole cohort of individuals. I love that idea.
Yeah, for sure. So, do you have any last thoughts you want to share with the audience?
Yeah, I mean, I think what I would say is just going back to this generational health point. I think it's just a matter of you have so much more agency over your reproductive health than you may have been led to believe. And this time period is such a robust one for the amount of impact that it has, because it has such reverberations for your family, for generations to come, that really, really focusing and honing in on this period of time is such a beautiful way to give your children the gift of legacy, right? We think about legacy in all these different ways, but health is an incredible legacy to be giving children. And so it starts in this preconception period. And if we treat it as such, there's just so much richness that we can offer ourselves and our future families.
Well said, Alexandra. Thank you so much for coming on the show today.
Thank you so much for having me.
Well, I hope you enjoyed today's insightful conversation with the amazing Alexandria DeVito. I really appreciate and honor her commitment to bringing awareness about fertility. Really starts before we start trying to conceive. And that's what preconception means, ideally 6 and even 12 months before we actively try to conceive a baby, when both partners are really consciously preparing their physical, mental, emotional, and spiritual health to make way for bringing this new life into the world, and how that will optimize the pregnancy as well as the health of baby and mom when this work is done, and how we can impact the epigenetics of the baby by doing this conscious work beforehand. And if you want to learn more about Alexandra, you can check out getpoplin.com or go to 9monthsisnotenough.com.